Today I have the absolute pleasure of talking to Dr. Stefani Kappel, a board-certified and double fellowship-trained dermatologist who has been practicing dermatology for over 15 years. Dr. Kappel, who practices cosmetic dermatology in Newport, California, also has a channel here on YouTube on which she very generously shares her incredible knowledge with us. Not only is she wicked smart and beautiful, but also very empowering. Now, most of you already know Dr. Kappel and love her as much as I do. In fact, I had posted on my community page that I was going to have the pleasure of interviewing Dr. Kappel and asked if any of you had any specific questions for her. And boy, did you have questions. I think I got over 100 questions for Dr. Kappel. So without further ado, let's talk to Dr. Kappel and have her answer some of your questions. Dr. Kappel, it is so incredible to have you on. I've been so looking forward to this. Thank you so much for taking the time. I know you're a very busy woman, so thank you so much for taking the time to talk to us.
Of course. Thank you so much for having me. It's just my honor and pleasure to be able to just talk to you and making the time for me. So I appreciate it as well.
My audience loves you. I put on my community page if anybody had questions for you, and I got about 100 questions.
Wow.
So
that's great. That's good.
Yeah, many of those you've answered in your videos, and I will link all of those videos down below because I know it can get repetitive, but I kind of grouped the most popular questions together. Let's get started with, if somebody's on a budget, what could somebody get the most bang for their money with, as far as in-office procedures that aren't invasive?
For sure. So as far as procedures, I always say it's always good to look at each individual patient or person because different people have different skin ailments. Sometimes people struggle with melasma or rosacea or they want more anti-aging. So everything, that is available to us can be used to target different aspects of the skin. Or if there's one predominant factor that someone really wants to focus on and they're on a budget, I say kind of put your investment in time and money into a treatment that's going to give you the most bang for your buck. Meaning if someone has melasma, you wouldn't want to do like a V-beam treatment for rosacea. You want to put it into correcting the melasma because usually when you treat that one predominant skin ailment, everything looks better and you'll feel better and your skin will be healthier. So I think, though, tried and true, one of the best things that you can do, I'm a really big proponent of fractal and refractionated resurfacing lasers, only because the people who have been doing those procedures over a lifetime have the most beautiful, glowing, healthy skin that really starts at like a cellular level. Even, my patients in their 7th and 8th decades of life who have kept up with, doing like a Fraxel. It doesn't have to be once a year, but every couple of years to kind of reverse sun damage, to stimulate collagen, to stimulate elastin synthesis, and all those extracellular matrix proteins that we start to lose as we gain wisdom and have birthdays. To kind of upregulate the skin to make that again is really a really great investment. Also, from a medical standpoint, it decreases your risk of skin cancer and precancers, which is, contributes to overall skin health. Because I always say healthy skin is beautiful skin, right? So if you're not doing it for cosmetic reasons, do it for your overall skin health, which will always benefit you. And, it doesn't have to be too pricey. If there is an area that you want to be more focused on, for example, like the mid-face or maybe under the eyes, which is an area where people need a little bit more TLC, you don't have to get the whole face done. Maybe focus on an area that is more, that needs a little bit more TLC than other areas of the face. But I think Fraxel and lasers are one of my favorite minimally invasive non-surgical treatments to help skin look its best at every age over a lifetime.
Wow, so you just packed so much in there.
Sorry.
I want to go back to a lot of these things. But one thing I really appreciate about you is you're so empowering to women because obviously all of us want to look our best.
Of course.
And sometimes, of course, it's a superficial thing. And sometimes it gets a bit of a bad rep that, we want to look good. But it's human nature. We all want to look good. Even animals want to be attractive.
Right.
But what I love about you is that you're so empowering. You do suggest things that are non-invasive. And, as long as money is somewhat available. are available to just about anybody. So I really appreciate that about you. You don't
Oh,
just jump to get a facelift, which a lot of,
no.
doctors do.
Yeah, and each individual patient is different, not only with their skin and their skin type, but their financial situation or their budget or their timeline, or even if a budget isn't even an issue, sometimes there's a family member or a spouse or a significant other who women are in a tough place because we're expected to look a certain way, or but we can't really be open about it. There is judgment, not only from our friends and family, but from our significant others. So I struggle with that in my office with my patients, and my patients they mean everything to me because they hold a special place in my heart, because sometimes I really identify with a woman who is, I don't really want my husband to know, but I really want to do this for myself, or I've been taking care of my sick mother and it's just really aged me and I just need a little pick me up. And I just really am empathetic to that, not only their skincare goals, but the situation that they're in, whether it's financial or limiting in some other way too. So it's important to keep that in mind as well.
Yeah, and that really comes across that you do care.
Yeah.
And sometimes it's not a significant other. Sometimes it's women not letting other women age. It's
right.
like you're damned if you do and damned if you don't.
You can't win.
Yeah.
Sometimes. Yeah.
But so like I said, you packed so much into there. So first of all, lasers, Fraxel and other lasers. There's been a lot of concern about fat loss.
Right.
What do you think about that? Is there any concern with any of these lasers?
Right.
In the right hands with you, probably not. But let's talk about that as far as fat loss.
Yeah, and definitely fat loss is, it could be a significant risk that you have to worry about. That's more actually with energy-based devices, not so much about lasers. So it can be confusing, the difference between the two. So, laser just stands for light amplification by the stimulated emission of radiation. They're photons and they're light sources that don't really penetrate deep enough to cause fat atrophy or melting of the fat. However, energy-based devices, which are not photons or light, but they're energy, so your thermage, your soft wave, your thermotite, those use heat in various energy forms, either radio frequency, microfocus ultrasound, different energy forms that put heat into the skin to stimulate collagen and the anti-aging effects. Those can melt fat when they're in the wrong hands, or it's an old, outdated platform of device. And I always feel that it's really important for me to use, my YouTube channel as a platform, because I am non-sponsored and it is kind of the Wild West out there. There's a lot of people who are, maybe don't have the education and training to talk about the devices. And there's a lot of fear mongering about, misleading, misconceptions about treatments. But I feel that it's important to have, true and honest information available to patients so they can kind of ask their provider questions to keep them out of harm's way when it comes to complications. So a lot of people, or a lot of med spas nowadays, will not want to buy the most updated platform. For example, say with Thermage, or it's through the company Solta, you have to get the FLX platform, which is the most updated software. But what sometimes people do, because it's a marketing industry, unfortunately, med spas will try to cut costs and buy old machines from like 2005. Those machines could melt fat. They achieve temperatures high enough to melt fat, whereas the FLX new updated software, you can't even get to temperatures that high, so you're safer. And then combining it with a provider who really understands the physics behind the devices, how it affects skin histology, the later sequela of what happens in the skin, meaning if you do a treatment now, in 3 months from now, are you going to have fat atrophy? How do you avoid that? And it really comes with a high level of training and skill, which can sometimes be a little bit higher price point, or better said, if you see a low price point, there should red flag you to think, why is this so much cheaper? Is it because their overhead's cheaper because they're using a less, updated platform, or is their provider's not as highly trained? So fat atrophy and fat melting can happen, not so much lasers, but with energy-based devices in those scenarios. And so, asking your provider, how long have you been doing this? Did you buy this machine or are you renting it? I always empower my patients and my followers, don't be afraid to ask your provider questions, because if you're trusting them with your face and you're giving them your hard-earned money, you should not, feel bad asking them, how long have you been doing this? Where did you get your device? Is it updated? Do you stay stay on top of, the new updated software, when the devices continually update at least once a year and become better and better and safer. And that's a good way to protect yourselves from, melting of the fat, because it can happen when temperatures are too high or it's done incorrectly.
It actually happened to me. I went and had radiofrequency microneedling. And, I always thought if a little is good, more is better, right? So I had the provider go really deep. And it happened gradually. And on top of that, I had a lot of stress. I lived in a very moldy environment. So there was a combination of things. But I suddenly looked in the mirror and thought, what happened? So yes, I saved some money because I went to a cheaper provider, but I spent thousands afterwards on biostimulators to get some of that volume back. So
yeah, and sometimes that happens. You spend more money reversing the complication than you would have. Yeah, I'm sorry that happened to you. Well, you look beautiful now. I would never know. Your skin's
Thank you
perfect.
so much. Since we are talking about biostimulators, I have quite a big audience that is interested in that because I did make some videos on that. And I think there's a lot of, first of all, misunderstanding about what biostimulators are, such as Sculptra. I actually had Lanuma, which I know is not approved in the United States. I was in Paris back then. But so the fear is, and I got a lot of questions on that, does Sculptra or biostimulators such as Sculptra, can it create the wrong kind of collagen, scar tissue?
Yeah, that's a great question. So biostimulatory fillers, through a chemical reaction, induce the fibroblasts, which are the collagen producing cells, to make more collagen. And in the skin, as you probably are well aware, there's types 1 and 5 collagen. There's lots of different types of collagen that exist not only in the skin, but the eyes, the tendons, the bones, and so forth. But what gets induced is collagen type 3. With a lot of the aesthetic procedures we perform in the office, whether it's Sculptra or biostimulatory filler or even energy-based devices, and lasers, there is an induction of synthesis of type 3 collagen, and it's actually a healthy type of collagen. Kids and babies have a lot of type 3 collagen, and you lose it as we get older, and it's replaced more by type 1 and 5. But the great thing about collagen type 3 is that it actually has a lower melting point. So with subsequent treatments, you're a little bit more responsive. So it's kind of like becoming conditioning your skin to be more responsive with subsequent treatments. But it's not a bad type of collagen. It's actually a great type of collagen and a more youthful type of collagen. So it also induces synthesis of type 1 and 5. But that type 3 is kind of a novel type of collagen that gets produced. And there isn't really any contraindications from, people having biostimulatory fillers and being candidates for surgery later on. And that's something that's a little disheartening to me, because I see my colleagues on YouTube and other social media platforms saying, if you have Sculptra, you're not going to be a facelift candidate. And it just kind of saddens me because, the plastic surgeons want you in the OR. And I get it, and I know that they spend 7 years of their residency in the OR, but they don't really have much dermatologic training or injectable or minimally invasive training as dermatologists do. So it's kind of disheartening to hear them say things that may not be 100% true, but are feeding their practice and kind of, catering to their agenda. And I come from a unique perspective because I am a cosmetic dermatologist and I practice non-invasive, minimally invasive, non-surgical treatments. However, I'm fellowship trained to be a Mohs micrographic skin cancer surgeon as well. So I've had a large patient population over 2 decades in my career where I was doing, rhombic transposition flaps and corrective reconstructive surgery on a patient population who has had a history of biostimulatory fillers and energy-based devices and so forth. The scar tissue is a little bit, more dense, but it would not preclude you from having, reconstructive surgery or a facelift or a neck lift. So I can speak as a surgeon and a non-surgical dermatologist. And I feel that there's a little bit of fear mongering that goes on with that as well. And it's important to remember scars have a lot of collagen. So, and anti-aging is, results from stimulation of collagen. So by saying scar tissue, it's kind of universal with saying collagen. And so when you're saying it's inducing scar tissue, it's just kind of synonymous with saying collagen. So it can kind of be misleading because scar tissue has kind of a negative connotation to it, whereas collagen stimulation has a very positive, beneficial connotation to it. So, but they're pretty much one and the same. And I do think that sometimes it's more to gain an agenda, like you don't need Sculptra, you need a facelift. And, even if you're 30 years old, just get you into the OR, which I don't feel is ethical in my opinion, but just
I
kind
agree
of,
with you.
yeah.
Yeah. And you just answered the second part of the question. So thank you. Now, I'm assuming since threats are basically the same, PLLA, it's the same
Yes.
with threats, right? So
Yes.
no somebody getting threats, same
Right.
sort of collagen production, and no risk as far as somebody wanting a facelift later on.
Right. I think thread lifts are a great, option. I mean, it's not for everyone. I wish they lasted longer than they did, but it wouldn't preclude you from having a facelift later on. Now, if it was within a year of their placement, your surgeon may run into them, but it's not going to disrupt the tissue from placement and, manipulating the tissue surgically. And I think thread lifts are a great option for people who are not quite ready for surgery or want to kind of buy themselves a couple years in time before moving on to have a surgery. And I feel that biostimulatory fillers, same thing. They're a great option for people who aren't ready for the OR, maybe want to buy some time, and they can absolutely be surgical candidates later on, even having these treatments in their history. So I think that, I think that they're a great option. I will say intraoperatively, speaking as a surgeon, sometimes dermal fillers, you can see the filler there. It does last a lot longer than we had, anticipated, back in the early 2000s when they were gaining popularity. But again, it wouldn't preclude a patient from being a surgical candidate. It just may be a little extra work for the surgeon to kind of pluck out the hyaluronic acid, filler from their SMAS, but it wouldn't preclude you from being a surgical candidate. So I don't want anybody to worry if they've had any of these treatments that they won't be a surgical candidate, because that's absolutely not true.
That's great to know. And many of us get these treatments because we don't want surgery even down the
Right.
road. The other question I got on biostimulators was, and it's kind of an interesting question, is there a limit of how many treatments you can have in a lifetime? It's probably hard to answer, but
No, that's a great question. Are you talking with respect to biostimulatory fillers? Yeah, so there's not really a limit. Of course, aesthetically, you wouldn't want to do too much. And before you achieved a dose that may be harmful from a medical standpoint, aesthetically, you would be looking kind of not like yourself and a little odd, which would probably come first. But there really isn't a maximum of amount of filler or biostimulatory fillers that one can have. I do feel like you kind of tap out and you get to a point where there's maybe a little bit of diminishing returns. So for Sculptra, for example, it's the company used to say 1 vial per decade. So if you're in your 60s, it's 6 vials. I think that that's a little excessive. To be honest, with my patients, anywhere from 1 to 3 treatments spaced about 1 to 2 months apart is a gradual, very natural looking progression. And I rarely do more than 2 to 3 treatments, not because there is any deleterious outcome if you do too much, but just because you don't want to have that overfilled look. But as far as I'm aware, I mean, I'm sure there's, too much of a good thing, but from a pathophysiologic standpoint, I don't think that there would be any contraindication for having too much biostimulatory effect in the skin, but with the exception of you may look, overfilled and disproportionate and have that look that none of us want to achieve. So I think it's, there's nothing really harmful from a medical standpoint, as far as my knowledge, can say.
Now, the last question on biostimulators before we move on,
Yes.
my provider back then told me it's not something for people with autoimmune diseases. Do you agree with that? And if so, why is that?
I just always feel that, whenever you're stimulating signal transduction cascades and cellular activity, if there is some autoimmune, pre-diagnosis, I always proceed with caution. I myself, as a dermatologist, will have a patient get serologies and follow up with a rheumatologist who is monitoring them. And depending on the autoimmune disease, some autoimmune diseases are less worrisome than others. I think it would just really have to depend on the specific autoimmune disease and working in collaboration with a specialist, the rheumatologist. But for the most part, I feel like it's safer just to err on the side of caution. I'm very conservative and very risk averse as a provider. So I may not, but a colleague of mine may disagree with me if we were at the podium debating this, topic. But I always say that each individual entity is different with respect to autoimmune disease, and it just depends on how under control it is and actually what specific type of autoimmune disease it is. But I always say it's better to err on the side of caution and maybe go with a different modality than a biostimulatory filler or other treatment.
Yeah. Thank you.
Hopefully that was helpful.
It was. Thank you. Now, earlier you mentioned V-beam for rosacea, and I do have a couple questions on rosacea. I actually used to have really bad rosacea in my 30s. And back then, antibiotics was the treatment of choice,
Right.
which did nothing. So eventually had some IPL treatments and they made all the difference in the world. But would you say now that V-beam is actually better than IPL for rosacea?
I do. Yeah. So IPL is just intense pulse light, which is the same kind of as broadband light or BBL. They're actually not true lasers because they're not in a collimated waveform. They're kind of just a broadband light that you put a filter on that enables them to kind of target certain chromophores. But V-beam is a 595 nanometer wavelength laser that's very targeted to hemoglobin, which is what we call the chromophore, what the laser is attracted to. So it's a very specific, very elegant treatment for rosacea. So I've used both and I've compared them side by side, and V-beam definitely produces better results, happier patients, more consistent results with longer lasting outcomes. I think just because of the degree of elegance and specificity in the physics behind the device. If that makes sense.
It's also a good treatment for poikiloderma savant, right? Which
it is, yes. It just gets that, just whenever you retract those blood vessels and get that readiness out of the skin, it allows the skin to have that beautiful glow as your skin is glowing. It has that beautiful glow. Whenever you retract those blood vessels back, it just, whether it's poikiloderma savant or just, just sun damage, rosacea, or just people get facial flushing, for other reasons. And it just, when you get that readiness out of the skin, it just has this beautiful glow to it. And it's one of my favorite treatments for poikiloderma savant. If there's some melanin in that entity, usually we'll do a laser to help relieve the melanin as well, whether it's like a Pico or a Fraxel, Clear and Brilliant, or a YAG. But it just, all depends. But it's one of my mainstays of therapy for poikiloderma savant for sure. I love the V-beam. It's a very underrated laser.
Yeah. I need to get some treatments from you
I
for
got
my
you.
neck and my chest. But you just mentioned I'm glowing. I'm using your skincare and I love it.
You are.
I love it.
Gosh, your skin is so beautiful.
Your skincare is amazing. It's simple. It's amazing. It works.
I'm so glad. I'm so glad. Yeah, I just really love engineering these products just for my patients and just know exactly what actives need to go where, how to get the vehicle delivery systems to get them there and remain stable and just have the effects that we want to. And just, being able to analyze it histologically and in the laboratory, making sure that, everything is perfect and just, the way I want it to be is really, really gratifying and rewarding. So thank you for using them and your skin looks incredible. I'm very honored.
Thank you for creating them. I actually want to jump back to that in a second, but I want to finish up the rosacea. As far as rosacea, many times people get prescription treatments for rosacea, but the questions were, can they use any sort of actives with those treatments or with rosacea in general? Ascorbic acid, retin A, something like that.
Sure. Yeah, I think, you don't have to be afraid to use your actives with rosacea, but you may have to, just be aware of that increased sensitivity or barrier disruption with rosacea. So, definitely it's safe to use even like a tretinoin or, a retinol or vitamin C or antioxidants, what have you, with rosacea, but you may have to adjust the frequency or the vehicle in which you're applying them to the skin if you're undergoing treatments as well. Like, for example, V-beam or IPL or, any other treatment may compromise the skin in a way to where things that don't usually make you sensitive make you have an increased sensitivity to, especially with rosacea-prone skin, because, the vasoactivity of the vessels will make you even more predisposed to irritation or reactions than someone who does not have rosacea. But it's not to say you can't use your actives, but I always say, kind of take it down. If you're using an active every day, maybe use it even just twice a week and just kind of see how you do for a couple of weeks and then increase it gradually, every couple of weeks as tolerated. And you may get to a threshold where it's too much. And then, to just take a step below that and stay there.
Are there any actives you think would be better, such as azelaic acid? For me, azelaic acid doesn't work at all. It really irritates my skin, strangely enough.
I have some patients who really like azelaic acid. I'm not the hugest proponent of it. My vitamin CFK, the way that it's engineered with other antioxidants, I've made it a certain way to where most of my patients who have rosacea and sensitive skin, I kept them in mind when I was engineering my line. And I feel that, vitamin C derivatives can be very impactful for rosacea, L-ascorbic acid containing vitamin C blends, as long as it's formulated and engineered the right way, lipophilic, liposomal, And with vehicle delivery systems that aren't just going to sit on the surface of the skin and ignite that vasoactivity that we're trying to avoid. I think vitamin C and antioxidants are one of my, vitamin C out of my antioxidant options, probably my favorite. But again, that all just depends on like a very elegantly engineered vitamin C, because they're not all created equal. But although a lot of people do like azelaic acid, I'm not the hugest proponent of it, because it does cause a lot of irritation to many of my patients. So I always say just proceed with caution with that active, and other over-the-counters and prescription strength medications as well. It just rosacea is always on a continuum, and there's various flavors of it. So what works for one person may not work for another. Like one may have, a response to, Sculptra if they have Demodex. Somebody who's devoid of Demodex may not respond the same way and may respond better to an antioxidant. So it all just depends. So, being informed, trial and error, going low and starting slow, I think is really, really important.
I actually have one more question on rosacea.
Yeah.
I feel for me, there was a big dietary component as well. I was eating quite inflammatory diet back then. And when I focused on more omega-3s and less omega-6s and really got that balance a little bit better, that is when things really changed for my skin. Do you see that in your patients?
Absolutely. I can't say that enough. And I can't agree with you more. And that's amazing that even in your own body, like you could tell the difference between omega-3 and omega-6. It's really important. Not only your gut health and your skin microbiome are so connected, but just our dietary, exposures, what we eat every day has such a dramatic impact on skin with, high glycemic index foods and the glycosylation and the inflammatory cascades that are associated with that, and what that does to our collagen and to our blood vessels with rosacea, which we're talking about. It really is important, in a perfect world, we would all eat clean and, eat the best that we can. And I know that there's going to be days where we don't, but it really can optimize skin health, what you put into your body and how your skin responds. I always say the skin's an outward representation of our internal health and our diet as well. And that's really, really important too. So all just, gluten, dairy, high glycemic index foods, all the things, and just, we all already know with rosacea, the vasospasticity is so in tune with, spicy foods, hot beverages, alcohol, all these things that we always say all the good things, not the good things, but, sometimes, people get upset when we cut out those things from their lifestyle, but it really can help make your skin overall healthier and, help clear rosacea, sometimes diet alone without any treatments or medications.
I know for me, not only rosacea, but I used to get perioral dermatitis, and I had it for years. And I changed my diet. Within 2 weeks, my perioral dermatitis disappeared, and that was 8 years ago. And I haven't, knock on wood, I haven't had it.
Right.
But I also noticed that I can tolerate retin-A better because I have less inflammation in my skin.
Yes.
So I think what we put in is just as important, if not more important, than what we put onto the skin.
Definitely. I know both of my kiddos, I have a 10-year-old and a 14-year-old, they both suffer from perioral dermatitis. And, I have to watch watch what they're eating and watch their diet, and just diet alone with them will help, curb that inflammatory cascade in the skin. So it's really important for sure. Absolutely.
Yeah. But let's talk about cosmetic formulations. Because, I get this a lot when people, oh, you spend so much money on these products. Why don't you just use a vitamin C from the ordinary or whatever? And while I personally don't think you have to spend a lot of money on skincare, I think formulation really matters, and ingredients, of course. So your ascorbic acid is the only ascorbic acid I've ever been able to use, not just on my face, but my neck, because my neck likes nothing. On a daily basis, I can use it on my neck without any irritation. And I've tried other ascorbic acid. So it's not the ascorbic acid, the L-ascorbic acid.
Right.
It's the formulation in general.
Right. And I think just, my, years of education and studying the skin, looking at it under the microscope and working in research labs where I can actually test the products in the vehicle delivery systems and do skin biopsies before and after with trichrome stains and actually see collagen upregulated and correlate that clinically with what we're seeing in the outcomes. I think just really being passionate about it and spending my whole career really studying the skin and understanding what needs to be, happening in the skin with respect to actives and stabilizing them in vehicle delivery systems was really my passion. And I feel my initial interest in it was when I was a Mohs skin cancer surgeon, and I would look at, when you do skin cancer surgery, you look at the skin under the microscope to make sure that the tumor is clear, and then you sew them up and you send them on your way. But I'd be very mesmerized by looking at all the cells under the microscope in the epidermis, the papillary reticular dermis. And I remember looking at my skin cancer patients, and yes, we would clear the skin cancer, but I would say, why does this 60-year-old woman look like she has 30-year-old skin under the microscope? Not just clinically, but like her cells looked younger. Her cells are producing collagen. Her cells are, having an even distribution of the melanin in the right platforms and the right levels. And I became very intrigued by that. And I would look in the chart and say, what products is she using? This one's using a vitamin C. This one's using a THD. This one. And so it really kind of got my brain going. And then later on in my career, I was approached by different skincare companies to ask me to be a formulator for them. And, as being dermatologists, they just want to use our brain and then put it to big pharma, cut costs, cut corners, and have business people involved in producing these products. And I kind of saw the lack of translational data going from what a true formulator and a true dermatologist would want in a skincare line, give that to the bigger companies, and they just would destroy it by cutting costs, swapping out for cheaper actives and cutting corners, and then selling, with these bigger companies. And I said, I wanted my patients to be protected from active ingredients being swapped out for cheaper products, or having, a fancy packaging and a lot of marketing with a lot of influencers, posting, but having bad products. I just wanted to be able to have a very pure, very scientifically elegant next level generation of like translational skincare. And that was the impetus for me to start my own line, pretty much just for myself, my own family members, and my own patients. And then it just kind of grew and grew and grew. And, I refused to let anybody buy me out or have an influence on my direct, communication with my personal chemist who I've hand selected. It's just him and me. And we formulate these products in a very kind of like boutique-y, very small company fashion, and just deliver results that give beautiful skin to those who use it. And that is something that I'm very, very passionate about. And I think what sets me apart is that the technology and the innovation is protected, and it can't be influenced by anything from the outside, especially in the world we live in now with aesthetics and marketing and social media and influencers and false promises and fake science. I just wanted to have a very clean, pure line that just gave results reproducibly with happy customers. So that's kind of the impetus and the story behind it.
I really appreciate that. Being an influencer, I hate that word, but being an influencer, I get emails every day from skincare companies.
Sure.
So this is the new best thing. And I look at the ingredients and I go, why? There's nothing in there that warrants the change that you promise. So
right.
What I love about your skincare is that it's simple. It has the scientifically proven ingredients, ascorbic acid, vitamin A derivative.
Yeah.
But the question I got, quite a few questions I got on formulations was,
Yes.
How do you feel about growth factors? I already know that, but I still would like you to tell us, and then we'll talk about the other ingredients.
Right. I know it's a controversial topic, and I always like to proceed by saying first that this is just my opinion, and we're all a product of our education and our experiences and our training. And although I do believe there is a huge benefit of growth factors, exosomes, and so forth, because of my history as a skin cancer surgeon, any patient who had a skin cancer or melanoma or required skin cancer surgery, we'd have to stop all growth factors and all exosome exposures on the skin, because there was we couldn't say that it did or did not increase neogenesis or tumor genesis or overactivation of cells in a negative way. So as much as we want to stimulate cells to have cellular activity like collagen synthesis and cellular proliferation, sometimes too much of a good thing or too specific of one growth factor targeting one receptor and one signal transduction cascade can lead to tumor growth or tumor genesis or possibly neoplastic activity. It's not saying that it can or it does, but because I'm from a history of education and training where we had to stop all patients on growth factors and exosomes. It's hard for me as a formulator to put them into our products just because that's in my, in my brain and in my background. I feel that peptides are a lot more elegant and a lot more controllable, and can achieve the same goals, even probably better sometimes than exosomes and growth factors, without the risk of a potential neoplastic activity. So I feel that peptides are a lot more scientifically elegant and a lot easier to control the outcomes that they're inducing in the skin cells. But again, that's just me. That's not, and I always say, be open to listening to other providers who have different educational backgrounds, because, it's just always important to, take it with a grain of salt and say, oh, she feels that way because she came from this background or training, or she had this experience with this product.
Better safe than sorry, though. And
Right.
I would imagine that peptides are probably a bit more stable too than especially exosomes.
Right. Yeah. So
how about DNA repair enzymes? Those are becoming, I know you have some in your products.
Yes. I love DNA repair enzymes. I think they're very elegant, very effective ways to help with, anti-aging effects, and also decreasing skin cancer and precancer incidence as well, reversing sun damage. I'm a big proponent of DNA repair enzymes because once you're repairing DNA or any mutagenic activity, not only are you making the skin healthier, you're making the defenses more stronger, you're making the defense more strong, you're strengthening the barrier, you're decreasing the incidence of mutagenesis that can lead to not only skin cancer, we're using skin cancer, but I'm talking about other neoplastic activity like SKs, sebaceous hyperplasia, angiokeratoma, angiofibroma, elastosis, all these things that the skin has mutagenic activity from various environmental exposures, UV light, blue light from our devices, toxins that we come into contact with, even in our diet. It's kind of like a corrective system that if you can implement that in a skincare product or, a daily application to your skin, it's going to give you an extra shield of coverage from these things happening. So I do think DNA repair enzymes are very beneficial and very healthy for the skin.
Which of your products contain them? I think your eye product and your neck cream, right?
Exactly. And the NMF hydrator. Yeah.
Oh, the NMF hydrator too.
Yeah. Hydrator, the eye serum, and the neck tight as well.
Good to know. I'm covered. My DNA is being repaired. That's good to know.
And it also has the Polypodium leucotomas, which is it's a plant-based enzyme that helps protect against damaged DNA and has DNA repair enzyme activity in it as well. It's a very underrated active ingredient, I feel. That in the science world and in the medical community gets a lot of hype. But it's funny because what happens in the medical community at our, dermatology academic meetings and so forth, sometimes it doesn't always translate into like social media and the public. So I try to be a liaison to just keep that information flowing so that people get the true, most advanced scientific discoveries and, medical advances that are happening in that world.
We really appreciate that. Now, is that the same as you take in HelioCare? Is that the same ingredient?
Yeah, it's the same ingredient. Yeah, so you can have it topically on the skin or ingested in like a pill form. And it's funny because now that I'm past so as a board certified dermatologist, after 10 years of graduating, you have to recertify your board. So every quarter, the American Board of Dermatology, I have to take an exam and stay up to date with all the newest, latest discoveries and technologies. And it's funny because I have my personal chemist who formulates with me, and I'm taking my board exam and I'm like, oh, there's a new discovery. And I'll text him right away. We need to get this active ingredient in our products or look into this pathway or whatever. And that Polypodium leucotomas actually just recently came up with some new exciting pathways and effects in the skin that are like a recent discovery, which is really exciting. So just a science nerd and love to incorporate that into my products, but it's a really fun, it's a great active, and there's other really great DNA repair enzymes too that have gotten a lot of hype lately in the medical community. So it's exciting.
Yeah. So you do actually update your formulations if something new comes up?
We do. Definitely.
Yeah. I really hope you enjoyed this video so far. Dr. Kappel and I ended up talking for almost 2 hours, and I could have talked to her all day. Her knowledge is so incredible and so in-depth. And of course, you asked some amazing questions. But I didn't want this video to be forever long. So I'm stubbing it right here, and I will upload part 2 of this video next week. Any questions or comments, please leave them down below. You know, I always love to hear from you. And I will link all of Dr. Kappel's information in the info box, along with some of her incredibly informative videos. Thank you so much for being here. Until next time, bye.